And it's been reported that SV40, this simian virus that was contaminated in these monkey kidney cells, causes or co-contributes to mesothelioma among other cancers. And when they do the research, they find, here's the 8th International Meso Interest Group meeting of 2006, and they're saying that the controversy over whether SV40 contributes to meso has not subsided, and is almost as controversial as the subject we just heard about, whether quercetin plays a role. And that it has the potential to influence the litigation in a very substantial way. Because when we tried lung cancer cases a few years ago, when someone smoked and someone breathed asbestos, from the defense point of view, we could argue to the jury that asbestos played a role, smoking played a role, and give us an allocation for the smoking so that asbestos doesn't pay the whole verdict. What happens if the jury now concludes that SV40 played a role and it played 30% of the cause of the mesothelioma? Do we get a credit for that from the jury? So it has a potential to influence a lot of litigation. Most mesos, when they're looked at under the microscope, contain the SV40 virus. It's in there. 100% of hamsters, when they're injected intrapleurally with the SV virus, they develop mesothelioma in 6 months. And what the suggestion is that about 80% of the mesos that are diagnosed are attributed to asbestos. There's 20%, is the general rule of thumb, where there's no known asbestos exposure. Nothing from the family history. Is SV40 responsible for those 20%? Are there safe levels of asbestos? What if it's the case, and this is a plaintiff's argument, that because the plaintiff has SV40 virus, they needed a lower level of exposure to asbestos to cause their mesothelioma. It changed their genetic susceptibility. So now a low dose is sufficient, whereas before it wasn't.